Last year, the Drug Enforcement Administration issued a warning about rainbow fentanyl. The name refers to the variety of bright colors of these types of fentanyl pills. The DEA says drug cartels created rainbow fentanyl to target young people, even children. With spring break just days away, the School of Science and Technology brought in a member of the Corpus Christi Police Department to educate its students about the fentanyl danger. Devon Taylor has that story.
Students at the School of Science and Technology are getting more than just a math and a science lesson, but now they're learning about fentanyl.
But it is absolutely terrifying that one pill can ruin our kids' lives.
Spring break is exciting for many students, but for teachers and school administrators, it can be a time of anxiety and concern. Among them is Katie Sheehan. She's the assistant principal at the School of Science and Technology.
Working in a high school, my biggest fear is that I send my kiddos off for spring break and one of them doesn't come back.
With the rise of fentanyl overdoses, that fear is very real. Fentanyl has killed more than 100,000 Americans in the past 2 years, and Katie Sheehan is trying to prevent her students from becoming one of those statistics.
By giving them this information, making them aware of the situation, making them aware of the dangers of accidental overdoses.
According to the CDC, fentanyl is now the leading cause of death for people 18 to 45 years old in the United States. Mark Schauer, the assistant chief of the Corpus Christi Police Department, says many overdoses happen because of the lack of knowledge.
Middle school or high school are probably more apt to maybe take a pill that somebody gave them, saying, oh, you're having some pain, or look, I just got these, get high at the beach. Those potentially could have fentanyl, and a speck the size of a grain of salt in there could kill them.
There is evidence drug cartels are targeting young people by making pills look like candy. But students like Christian are more informed.
I feel more confident in being able to protect myself and my friends around me, because now that I know that it is a very deadly thing, well, I can inform them and let them know and get away from all of that.
Devon Taylor, Chris 6 News.
The Texas Department of State Health Services monitors drug overdose deaths. They have recorded an alarming trend in the past 5 years. In 2018, there were 304 synthetic opioid deaths. Of those, 69% were caused by fentanyl. Look at what happens to the numbers in the following years. 2019, 381 overdose deaths. 83% were fentanyl related. 2020, out of 981 overdose deaths, 90% were due to fentanyl. 2021, nearly 1,700 deaths. Fentanyl was to blame for 94% of those deaths. The latest figures available only cover up to August of 2022. In just 8 months, nearly 900 overdoses were reported. 97% of those were fentanyl related. The Centers for Disease Control and Prevention say that more than 150 people die every day due to overdoses related to synthetic opioids like fentanyl. Knowledge can be life-saving, especially when it comes to recognizing the signs of an overdose. Look for small, pinpointed pupils, falling asleep or losing consciousness, slow breathing, choking or gurgling sounds, and cold or clammy skin. Even if you're not sure it's an overdose, call 911 immediately.